Everyday life's happening. Some days are more eventful. Others, living protected with insurance you can depend on changes your life for the better. We insure the people and things you care about. Not Agency. We'll help you find the right coverage so when life happens, you have the right insurance protection for your family and business. When life happens, live protected. Agency for all your insurance needs.
Good morning and welcome to Radio Friends on Tuesday, July the 11th. We're going to talk about one read today and then healthcare. Let's start first of all with Madeline Matson. Good to have you here, Madeline.
Yes, nice to be here.
Missouri River Regional Library.
Yes.
What have you got for us?
Okay. This is the 12th year of our Capital Read, which is our community read program. Yeah. Yeah. And our title this year is The End of Your Life Book Club.
Okay. And what is the End of Your Life Book Club about?
It is a remarkable, it's kind of a memoir. It's a book about the author who's worked in publishing for years, and his remarkable mother who has worked with refugees all her life. And she receives a diagnosis of pancreatic cancer, and her life is being spent for the next couple of years in hospitals, undergoing chemotherapy.
Right.
And he accompanies her, and they start talking about books. And both have obviously been huge readers throughout their lives, and they find that they're talking about a lot of the same books, and they have a book club.
Oh.
Yeah. So basically, it's a book about books, but it's a book about family, and it's a tribute to his mother. It's just really a beautiful book.
It's a book about love.
It is.
It's a book
about love. It is very much so.
It's called The End of Your Life Book Club. So you don't call it one read. You call it?
This is our Capital Read.
The Capital Read.
And it's the 12th year.
So what do people do then?
The author will be here September 28th at 7 o'clock, and he'll be here to talk, and his book will be available for sale and for his signing. But
you want people to read the book before
definitely.
then.
Oh, we'll have programs throughout the month of September, and we'll have book discussions about that book.
Okay, but then he will be here on
September 28th.
At what time?
7 o'clock.
Okay.
At the library.
At Missouri River Regional Library. But obviously we'll be talking about this with you before then again.
Right, I hope so. Yes.
Okay. So if they can get the book at the library?
Yes, we have multiple copies. Yeah.
To check out?
Yes, to check out.
Or they can purchase the book themselves.
Of course, at their local bookstores. So,
all right.
Yeah.
Madeline Matson, thank you so much for coming by.
Thank you, Paul.
It's a pleasure having you here from Missouri River Regional Library.
Thank you.
All right. Now, we're going to turn to a couple of people who are also from Jefferson City. This is kind of our Jefferson City segment here today. The Forum for Healthcare Reform. We have Mary Schantz. Good to have you here, Mary.
Thank you, Paul.
And Tony Smith. Now, what is the Forum on Healthcare Reform?
We'll be having a forum on Monday, July 17th in Jefferson City at Lincoln University to talk about how the proposals for healthcare reform that are out there today, how they're going to impact on the people in mid-Missouri, what it's going to mean for you and your family, what it's going to mean to our local hospitals, our local doctors and nurses, community health, how it's going to impact on us. We have a national debate going on about healthcare reform.
And there's a lot of emotion in this, too.
There is a lot of emotion.
There's a lot of emotion in this, but I'm not sure if many times people are looking far enough into what they're talking about in our government as to how this is really going to impact all of us. And one way or another, it's going to impact us whether we're on Medicare.
That's right.
Whether we're on Medicare with supplement, or if you're on Medicaid, or you have to buy your insurance on the open market.
Even if your employer pays for it, is through your...
So even your employer-based insurance.
That's right.
So this is a nonpartisan forum that you have?
Absolutely. It is a nonpartisan forum. We have some great speakers coming in from, they're nationally known, as well as our local hospitals are going to be on the panel, and several doctors and nurses. So it is very broad-based, it's very nonpartisan, and our goal is, just as you say, is to provide information not from a big national perspective with sound bites that we're all too familiar with through the political process, but in fact to provide information about how healthcare reform really is going to impact you, your children, your schools, your wallet, everything.
Our speakers will have about 45 minutes, and then we'll have a local panel made up of the hospitals, several physicians, the county health department, and there'll be a Q&A with everybody, so they can go over, the public can then come up and ask questions about things that might be of concern to them with their families or whatever.
Do you see us ever heading towards a single-payer system? Isn't that what it's called, the single-payer system?
Actually, I think the term that people are using more and more is Medicare for all, because Medicare is a large single-payer system. And I've never met a senior citizen who says, "Oh, I don't like Medicare."
Oh, no.
Never met
I've been on Medicare for a while.
Me too.
And I'm glad that we have Medicare.
Yeah.
I'm glad that we have Medicare.
Yeah.
We are one of the few developed countries in the world who, for some reason or another, cannot come up with that single-payer system.
Well, there are 31 industrialized countries in the world. We're the only one that doesn't have a healthcare delivery system that gives healthcare to everybody. We're the only one. But we sell healthcare as a commodity.
And well,
and if you can't afford it, then, but that's our system. And it can work with subsidies and help if that's the way you want to go. But single payer would be, or Medicare for all, would be a much better system.
Do you ever see that coming to this country?
Well, certainly the interest in Washington in a Medicare for all concept has begun to grow again because of all the divides between the ACA and the Trump Care bill. And Senator Sanders and others are beginning to talk about it much more boldly and drawing large crowds. When you think about even on the campaign trail, this was an issue that was resonating. And now that the president is talking about eliminating, or not eliminating, but changes to Medicare, I think that it's going to energize another group of people.
I think the only way things will change is if people realize how it is going to affect them personally.
Absolutely.
It affect you personally, and one way or the other, whatever happens with this, it is going to affect each and every one of us.
That's right.
So if you want more information about this, it's strictly nonpartisan, right?
Yes.
It will be Monday, July 17th, Lincoln University.
Yes.
Where?
Yes, on the campus at the Thomas Pauley Theater, which is in the Martin Luther King Hall, which is at 812 East Dunklin, and there's plenty of parking. We have information, so if you need special assistance or if you want more information, we have an email address that you can email us for.
Okay. What's the email address?
The email address is jcaindivisible at protonmail.com.
Okay, or just Google it, Lincoln University Healthcare Reform.
Now, I think that should be coming up.
That'll get it. We're out of time for today. Thank you so much. I hope you have a standing room only crowd.
Well, we hope to see you there.
All right. Wednesday, tomorrow, Maples Rep Theater will be on with some good music. Join us then. Bye-bye.